Kunumustahan is a project featuring the economic platforms of all presidential, vice presidential, and senatorial candidates, dependent on the publicly available data and successful interviews of representatives. Ekonsepto does not endorse any party or individual and will strive to give equal exposure to all qualified candidates.
Okay. Well, I believe that our general prescription of pandemic management should be based on science. It should be pragmatic, and it should be cost effective. Because we are in a crisis, in an unprecedented crisis of biblical proportions. And so every resource that we have should be wisely used in order for us to overcome the repercussions of this microbiological hazard. And as any hazard, we should follow the scientific approach of mitigating the impact of this pandemic. And we can only do so by addressing every issue and every problem based on science, based on good management initiatives, and it should be devoid of any political as well as commercial interest. Because once our pandemic response is adulterated by commercial as well as political interest, this will make our response less efficient. And the biggest, I would say, impact will be felt by the disadvantaged groups, especially the poor, because the rich would be able to afford better medical and public health services. They would have more access to medicines and hospitalization, among others. But the poor will be most affected, and so the disadvantaged communities, as you were saying, could benefit by the general policy of adopting science-based, pragmatic, and cost-effective pandemic response, mitigation, and recovery strategies. And if I may cite a concrete example, if you remember, there was a time when testing kits were prohibited and by the government, and it will only be available in a hospital setting. And testing kits to determine whether you have been infected or not, well, it's actually available off counter in the other countries, and it's a no-brainer. It's very simple to use, and it's quite safe. So why restrict when ordinary people could avail of such testing kits, just like testing a diabetic or other usual routine tests that you could easily follow with proper instructions and determine more or less if you've been afflicted by COVID or not. And with that monitoring, which could be done in the respective homes of citizens, that will help in containing the spread of the virus. But this was restricted in the past, and only recently it's being allowed. So there are certain policies that we will have to study, and that the granular lockdowns were also adopted, and that this should have been adopted, in the early days of the pandemic. And if this was done much earlier, then the economic repercussions of lockdown, of general lockdown, and mobility restrictions could have been avoided. And consequently, our economic contraction would have not been as bad as it is. But fortunately, the public-private sector collaboration, assisted by the UP medical and scientific communities, as well as the other distinguished or esteemed academic institutions, they were able to contribute the needed expertise and motivation to more effectively respond to the pandemic. And so it was a victory for the Filipino people when public and private sector collaboration was adopted, was embraced to address the crisis that we are now facing.
Ekonsepto, economics for everyone.